AFib patient organizations provide a wealth of resources for patients. We cover the medical conferences as media. We are distributed through Google News, and we have all these great resources. And by doctors sending patients to patient advocacy websites, doctors get a benefit too. What happens is that patients are more educated. They understand their condition better. They understand their treatment options. They understand why they're on anticoagulants and how to take them properly. And they're less likely to just discontinue them and not tell their doctors. They're more likely to reach out to their doctors when they need to make a change in their medications or when they're having side effects rather than just stopping them. Because they're more adherent, because they're understanding the entire spectrum of treatment options, they're more open to having discussions about other options if medications don't work. And because they're doing all these things and they're doing their homework, they're just more proactive patients, and they're much easier to manage. With being easier to communicate, being able to share the decision making with those patients, and with patients being more adherent, there's also a possibility that patients may have fewer strokes and fewer deaths because they are better informed patients. They're easier to manage for doctors, and patients have better outcomes. So patient advocacy organization websites provide a great deal of value to both patients and doctors. But if they're proactive and they understand what they've learned from their doctors, they're more likely to judge more critically that they're running across that is crap. And because of that, if there's something they're just not sure of, they're more likely to ask their doctors, but they're less likely to bring in a whole stack of stuff. It may be one thing they're going to ask their doctor about rather than a whole array of things. I guess it's possible, but I think one of the important things for doctors to understand is that most of the patient advocacy organization websites are fair and balanced. They're not skewed towards specific pharmaceutical companies or medical devices and those kinds of things. They're really more fact-based. So even if doctors do send patients to specific organizations, they're less likely to get a biased perspective from those patient advocacy organizations.